Mondays with Mike. Here we resume our discussion from last week on Mondays with Mike.
And that's why the number one cause of bankruptcy in the United States is medical debt, is that people who need a life-saving procedure, say you get a heart attack and you have to take an ambulance or get a helicopter ride from somewhere to a hospital for a hospital stay or to get a heart surgery. In most cases, people don't, when they're in an emergency, they don't get the choice of declining an ambulance or declining a hospital stay for an emergency procedure if they need it because
Yeah.
they're incapacitated, right? They're unconscious. If someone has a heart attack and 911's called and the emergency responders show up and bring somebody who's in an active emergency state, they don't get much of a choice.
Mm-hmm. Yeah. And my dad had to go to the hospital, and he was in a clinic, and he had to go to the hospital. And we were there waiting for 2 hours for the ambulance. The hospital was like half an hour away. I was like, I'll drive you to the hospital. No, they won't let you. Why exactly they won't let you? I don't know. And then the ambulance gets there late, and then the ride in the ambulance is like thousands of dollars. Next time, I'm driving him to the hospital. I don't care what they say. You get little things like that. And then I had a telehealth thing. I changed my insurance recently. It's actually pretty good insurance, but I changed it so that the thing you always pay, the premiums, were lower. And I went to a telehealth visit, and it was like $175 for 15 minutes. Excuse me, it's not worth that much. I did get a prescription out of it, and the prescription happens to be pretty cheap either way, but I was just like, this is not worth this much. And there's no capacity. Like, when you're in the hospital, they don't tell you how much the medicine costs, and there's no negotiation of it, and it's just extortion. And I just wonder how it came about. And I wonder if there's a way out of it. Because I think the expensive prescription drugs thing, is widely talked about and worthy to be talked about. But I don't think the medical establishment extorting you. And then there's this difference between the price that they try to charge you, and then the insurance. They were going to charge you $1,000 for that Tylenol, not literally, but something like that. They were going to charge you $1,000. We negotiated them down to $200, and then we'll pay $150 of it. And you're like, oh, I guess I got a 95% discount, all things considered. But it's just unacceptable to be charged that much money for little things. But what can possibly be done about it?
I think Bernie's answer is actually the best one, that we need a universal single payer system that can negotiate all of these for at least drug prices, because that's what most other countries that have huge healthcare systems do to some degree, is that they negotiate as one group. If you want to have a market for your medicine, you have to charge an affordable amount or you don't get access to the market. That's, I think, part of the issue in the United States, is that there are sort of these pockets of private and public healthcare systems that in some cases are very affordable if you have access to them, like Medicaid is very affordable for those who use Medicaid, and Medicare is arguably much more affordable for those who have access to Medicare. But everybody else is relegated to this sort of market where the wolves are feasting on the prey, as it were, of the medical consumer, doesn't have much of a choice and has to compete with what are frankly predatory institutions, in the sense that corporations have a responsibility to make as much money as they can for their shareholders. And so one of the facets that they can do that is to charge as much money as they humanly can for every element of every facet of healthcare. And this happens at all those levels of healthcare. So it happens for private medical providers who are charging what might be called exorbitant amounts of money because they're negotiating with private medical insurers, which are the middlemen between getting the care, getting the medicine. And there's one of the people, the gatekeepers of who gets to do that. And then you've got the pharmaceutical companies that create the end product, right? They create the medicine or they create the devices. And it's this sort of, how do I explain this? It's this sort of feedback loop where the incentives for everyone involved in the process, except for those who are explicitly nonprofit, meaning they're not seeking profit in the provision of medical services or in selling goods to the degree that they have to maximize it, is that every facet's trying to maximize as much money as they can legally get. And so government functions as the only check on that kind of system because government can operate removed from the profit motive in the sense that they don't have to seek the utmost profits. This goes back to this discussion of oligarchy we were having of, is the United States an oligarchy? Yeah, in some respects it absolutely is. And it's most apparent in the healthcare system, which is a fifth of our economy or whatever, that there are huge vested interests in making sure that everything stays more expensive. Here's an easy example. Doctors. There's a finite number of doctors in the United States. The only way to become a doctor in the United States is one of two avenues. You go to medical school outside the country and then come into the United States and pass the boards or whatever and get your medical license, or you go to medical school within the United States. There's a limited number of residency posts given out in any given year to those who want to become doctors in the country, and there's a limited number of spots total. There's a cap total that's determined by a private organization, not the government. It's the American Medical Association, all the various other groups that decide just exactly how many doctors, dentists, various medical providers there will be going through the system. That's by design to ensure that they make more money.
So it sounds like we need more medical schools.
So Nixon actually tried something to fix this. He was probably the closest anyone's gotten, as far as I can tell, to addressing this in a significant degree.
Really? Nixon, huh?
Nixon, where he proposed a national health service of paying doctors to go to medical school, and they would guarantee, it's like ROTC. So ROTC, the Reserve Officer Training Corps, is they pay for full ride for college so long as you promise to serve in the military for a certain amount of time. His idea was a similar concept of people would be paid to go to medical school by the US government, and then after serving a certain amount of time in areas where they need doctors desperately, their full medical school bill would have been paid. That I thought was a pretty neat idea of addressing a doctor shortage in rural areas and areas that need it. But what we need almost definitely is less private control over doctor medical licenses, but also more ability to, at least the government, to compete with training doctors. So the government does pay for people to become doctors, but it's mainly through the military. So if someone wants to be a doctor, they can join the military, and if they pass the test and they're found to be qualified to become a doctor, generally the military, at least my understanding, is that will pay for people to become doctors, to become lawyers, to go through school and get trained to do it so long, again, as they promise to serve a certain amount of time in the military. We need something comparable in our public system for doctors who, especially for family medicine doctors, because doctors obviously have a choice of what specialties to pursue. And if your tuition is extremely high for medical school, then it creates this need for doctors to pursue much more lucrative specialties like plastic surgery or something that doesn't necessarily provide life-saving care. And it leads to these artificial shortages of family medicine providers or doctors in less lucrative career tracks. So there needs to be a way to, if you want to reduce the cost of healthcare for people, for primary care providers especially, just increase the amount of scholarships or training that the government does, period. Just make it so that one way to do it would be to make it so that all medical school was free to anyone who qualified, and they would make certain promises at the end of it of where they'd serve, of that you create a sort of need-based service list of like, where do we need doctors the most? Anybody who agrees to serve in these specific areas of maybe not all medical school for free, but if the government made some kind of effort for the most need areas, then what you could do is meet these demands so there's less scarcity of doctors, which would reduce the prices overall, right? Because it's supply and demand. You increase the prices of things if there's a lower supply.
Maybe the military can open more medical schools if they're sending their own people to become doctors, because the AMA couldn't stop them, I don't think. Maybe we can use the military as an instrument of economic progress and social change.
It's already done.
Yeah.
Yeah, that's
Yeah.
where a lot of pilots get their flying hours. Because to be a
Hmm.
commercial pilot, you have to have a minimum number of required flying hours, just training, and
Hmm.
usually you have to pay for that out of pocket. One mechanism that pilots use to circumvent that need to pay out of pocket for the flight training costs and the flight hours is to go through the military. That's one of the big selling points of the military for pilots is
Yeah.
you serve in the military for 10 or 20 years, you get all your flight hours, you get all the training paid for by the government, and then you go into
Yeah.
private commercial flying ahead of the curve, as it were, for becoming an airline pilot, which pays much more.
Hmm.
Let's move on to housing. Bernie says that we have 800,000 homeless in America. We have 20 million people spending more than half of their limited income on housing, and we have a major housing crisis in America. And I would ask why, and my mind immediately jumps to it's probably supply and demand again. You got people demanding houses, wanting houses, willing to buy houses, and you have the supply of housing not enough. They have this problem in Canada, but worse. Does that jive with what you think?
So it's a lot of different factors. The US doesn't have a right to housing, which means that people have no legal right to sue the government if they can't find housing. A similar comparison of why are homeless people concentrated in certain cities compared to other cities in the US. The most homeless people in the US are in New York City in particular, because New York City has something called a right to shelter. New York City has to legally provide emergency shelter to people who are in the city and who are homeless. And so they have a 97% occupancy rate or something of homeless people living in shelters compared to Los Angeles. It was at around 30 to 33% of homeless who are in shelters compared to not. So when you're talking about something like housing, there's a similar problem. The stock of housing exists in two main hands, private owners, and then there's public housing. There's nowhere near the amount of public housing that would fill the current demand for housing that exists. The backlog for stuff like Section 8, I think it goes back 10, 15 years of people waiting on the waiting list to get housing. So it's nowhere close. And what makes that problem worse is when you have someone like Trump who comes along and says, oh, we're going to cut staff from these various agencies, including housing and urban development. Who's processing all these claims? Who's making sure that there's even available housing stock? Oh, the agency that was designed to do that, the housing and urban development. So all of a sudden, it's a bad problem that's become worse. So that's one facet of it, is that we know there are ways to respond to the issue of housing that do work, like public housing or Section 8 or vouchers or rental assistance. But the gears, the process of making the thing go from someone who needs help to getting that help is heavily reduced right now. It's stymied by one political party in particular that seems to have an antipathy, a disdain, as it were, for the services that the government provides to the poor, because you can see it being expressed in them firing so many people who would be part of the machinery that makes it all work. Firing thousands of people from Social Security, they're the ones that help in the disbursement of Social Security benefits, not only for those who are elderly who've reached retirement age and qualify, but also survivor benefits for those who are the children who are orphans, or for disability benefits. There's a whole list of things. And if you slow the process wherein people receive the actual funds that they need or that they're entitled to, then it becomes very difficult to pay for something like rental housing, where you have to pay rent on time every month. If you're not getting the money on time, you can't pay the rent on time, you get evicted. If you get evicted, then it becomes a mark on your record, you can't get rent. So then your only options, if you can't rent somewhere because you have an eviction on your record, become public housing, or they become paying outright for a house. Clearly, someone who is poor enough to not be able to afford to own a home already, and I guess not to afford to rent because they were evicted, they're not going to be able to buy a house. It's way too expensive. And so public housing then becomes the only option. And if there's not enough public housing, you're stuck. But that's one facet. The other facet is that there are a significant number of houses in the United States in terms of the housing stock, but they're owned, people own multiple homes, right? So you have someone who has a second home or a vacation home where they may only visit a week a year, but the rest of the year, that property remains vacant or it's being rented out for Airbnb or some other reason. So you have millions of houses that might be on the market in a different world that people could, pay for, but they're not on the market because they're held in the hands of those who can afford to. So then there's other issues. We saw from the housing crisis of 2008 that if you give a mortgage to anyone who walks in the door and wants a mortgage,
Yeah.
it crashes the whole system, right? Because of flaws in the system of how they were combining, they were doing the
Collateralized debt obligation.
collateralized debt obligations. They were putting all these different.
And the ratings agencies did not have their eye on the ball in terms of how to properly rate those CDLs, CDOs.
So all those people who were getting mortgages for the time that they were and having a place to live, they weren't homeless, but it was a ticking problem because we saw what happened. It led to a huge collapse of the system because greed ran rampant. So part of the issue with homelessness is that so much of the access to housing has such a high bar at both the rent level that you have to demonstrate usually 3 times an income level of whatever the rent is in order to be qualified for rent, and you need a credit rating and no eviction on your record. And also, it's worth mentioning criminal records, that generally people with criminal records have a much more difficult time of getting housing. Last I checked, it's something like 100 million people in the United States have some kind of interaction with the criminal justice system or some kind of record that affects their ability to get housing, affects their ability to get a job to pay for housing. And so the government is the one that would have to step in. And let's be clear on this, the government does know how to provide both housing and medical care to millions of people at cost. It's our prison system. And the problem is that if you want access to housing in the United States that the public pays for, you either have to commit a crime so severe that you get thrown in jail, where you get housing and access to food, and you're required to work a job, and you get access to medical care, or you're left to the wolves, as it were, of the private home markets that don't want to give you uh, a house if they can help it unless they're required to. And so the whole issue is just complex and myriad and has so many problems. But there are very serious. The one easiest answer would be a right to housing. That if you cannot find a way to somewhere to live in the country, you can sue the government to come up with a solution, even if the solution is something really simple like 4 walls, a roof, and land set aside on the national parks or some federal land, something where anybody who wants to can just go live there, right? But we don't have that. We have, have you ever heard the statement, don't let the perfect be the enemy of the good?
I certainly have. I think we may have heard it from the same person.
It's possible, but you see this play out right now in Seattle, where they have all this housing stock available, but they're not actually letting the people who need it live in the houses. They have all these empty houses that they built and spent millions of dollars building, but they're not actually letting the people who need to live there. And honestly, I think that's a failure of our politics, that we're aspiring to the very best that there can be. When in many cases, I'm sure there are people who accept just enough. The tiny house movement of just like a tiny little affordable home, you allow them to live somewhere and then they'll live there, right? But for whatever reason, we have systems in place that don't want to let people do that. And you go, wait a second, why? Why would we not allow huge numbers of tiny homes for people who are willing to live with less and still be happy? And that's where it goes to the failures of our political system. The number one lobbyist group by a far margin of our government at all levels of government
Realtors.
is realtors, and it's not close. They spent something like $90 million in lobbying, and the next highest group was 60 million. So there's a 30 million additional, just huge sums of money being thrown at candidates all across the board to not do anything on this, to just let the status quo be, or to make it even more difficult in terms of zoning, or in terms of permitting, or in terms of who is allowed to build, to not have tiny houses, or to not have effective responses to this problem, because the problem makes them richer, right? In the sense that if there's a limited supply of housing, the value of all that housing goes up. Everybody who currently owns houses makes more money. And since so much of the wealth of the country is tied up in the value of your home, there is no political will at all, really, to solve this problem with the drastic sweeping changes that would be required to actually make it just go away. So homelessness fundamentally is a choice of governments and of the markets.
So in the UK, maybe you know they have the bedroom tax. And so if we had some kind of home vacancy tax, the city government or whatever it is comes around every 2 months, is okay, does somebody live in this home? And if they do, you're not charged and they can check back again. Do you think that would make a difference?
It could, right? I mean, what would make the most difference is that you have houses that are completely separate from the private market. So one of the main issues for why there is, in fact, a higher rate of homelessness than there otherwise would be is the advent of Airbnb. Is that you've got houses that exist in the current housing stock that are not being sold or rented to families that would live there in the long term because it is much more lucrative to rent out the houses on a day by day basis. And so long as something as a more profitable alternative exists to letting people live in a home, you've got this really difficult problem of there not being enough homes that are just available to people who want somewhere to live so they can go to work, have a school for their kids, etc. And sadly, that's a function of capitalism, right? That people are ultimately acting in a rational way to respond to market conditions for what will make them the most money on their investment. And housing is an investment. So if there's no option separate from housing as an investment, then we're stuck with the housing as an investment option for everyone. And not everyone, frankly, can afford to pay the high cost of entry. So you need an alternative. And the alternative is going to be something like what they have in Hong Kong, where they have those single occupancy. They had it in San Francisco for a long time. It's the single occupancy rooms where it's basically a closet. It's like a pull-out bed and a tiny room, and you've got like a shared bathrooms or whatever. It's like a dormitory for at the very lowest end. Something like that, I think, would probably be the better response to homelessness at the lowest end. But obviously, if you want people to have a stable, secure life, the higher aspirations are great. But those higher aspirations serve as an impediment to just solving the problem. And the problem fundamentally is that in so many cases, people don't have access to any income because they may be unhireable, right? That there may be some element of their work history or their personality or the way they interact with the world that makes it very difficult for them to get access to any stable income. And you need a stable income in order to rent or to own anything in this country. So there has to be a solution for that group of people that fundamentally recognizes an inability to pay. And that's where I think the Republicans have real issues for me in terms of how they engage with social policy, is that virtually all levels of welfare they state has to have some kind of work requirement. The problem with a work requirement is that you have to have people willing to hire workers. And if they have discretion of any kind for hiring workers who have a criminal record, who have some kind of like difficulty, like a social communications disorder, where sometimes they may not like understand directions or commands that are given to them, you have no alternative, right? People either get a job and get access to the welfare, or they don't have a job and they lose access to welfare, they become homeless. So this goes back way back to when we were talking about that guaranteed job program. Just come up with something for people to do that has no barrier to entry. Sweeping streets, cleaning up trash. I don't care. Raking the leaves in all the national forests, staring at birds and writing down how many for research. It doesn't matter.
Research. There it is again.
Just come up with something that people can do so they have a stable income. And when they have a stable income, direct that money towards housing. They can do it in prisons, right? Anyone who's put in prison is required to work. If they refuse to work, they're punished. So, yeah, the government knows how to put people to work. They do it all the time. They've got a prison workforce. They've got a military workforce. They've got the millions of people who are federal employees. The government knows how to do it. There's just no political will across the board to have these what might be called pragmatic or practical solutions to this problem. You either have the very best or you have nothing, and nothing sucks. That's where we're at.
Yeah.
And it sucks even more when the Supreme Court says that your alternatives, sleeping on a bench, sleeping on a sidewalk, sleeping in a park, can be criminalized, because then it makes existing illegal around the country in the sense that there's nowhere that a person who doesn't have enough money can just exist unless it's a shelter, which there's not enough shelters for everyone, or it's some other alternative. It creates this sort of impossible situation. If we're out of time, we're out of time. Sorry. I go on and
just one more thing. That's why it's called Mondays with Mike. But just one more thing. Picture this. A tenants union. And the tenants double up. The tenants are like, okay, everybody who can, go 2 families to a house. Because then, the landlords, they can only rent out half the places. It'll be more than half, of course. But, I don't know, 70, 80, maybe probably even 90%. But that's still, try to increase the vacancy a little bit. Maybe. I don't know if it would solve it, but it might provide a little relief. Is that a pipe dream?
It's still subject to the discretion of landlords. Look, some countries have way lower amounts of homelessness than other countries, and it all goes to this values that the countries have. The right to housing. Thailand's a pretty good example of this. They have a right to housing, so ultimately people can create a little shack and say, this is my home, and then Thailand will figure out a way to allow people to live in that home. It's just a difference of approach.
But if all the tenants double up, what are they going to do? Evict all of them? They can't arrest all of us. Just kidding. I'm gonna cut that. They can't arrest all of us because don't storm Area 51. Don't storm Area 51.
They absolutely can, right? And that's part of this issue. If you look at the history of evictions in the U.S., it's used as a tool to get people who can't pay out of where they live. And the problem is that when you have an eviction on your record, it becomes very difficult to find anywhere to live because landlords, given the option, will not choose to rent to someone who has an eviction on their record if they can rent to someone who doesn't. But this issue is so multifaceted and so complicated because there's a movement to buy up residential homes by capital firms that have a lot of money lying around to buy stuff up. They're buying all these residential homes and ramping up the rents once they own them all in a neighborhood because they can. There's nothing stopping them from doing that. And the other issue is that they're doing something similar to what happened in the housing crisis, where it's instead of a mortgage-backed security, it's a rental-backed security, meaning that these organizations that have more money than God, I won't say that they have.
How much money does God have? I don't think God has a bank account.
All of it. If God's omnipotent, it's all of it. But they have more money than most other companies in the world that have billions and trillions of dollars of capital accessible to them that your everyday regular person just doesn't. How do you compete? Because what they can do is they buy up all these houses, and then a way to pay for those houses to sell these rental-backed securities where they say that the strength of their investment has additional money, this sort of security that can only exist because they have such a huge stock of rental housing, right? That they say the strength of the investment is based on the fact that since there is such a shortage of rental housing, that people will rent if they have to or they want to, and that you just find ways to raise the rent as much as you humanly can while still getting people to pay the rent. And then you make extra money on the side because of the fact that you have so much rental housing and rental apartments. It's a really terrible feedback loop. It creates terrible incentives in the whole system because it means that companies with huge amounts of money can outcompete virtually anyone, and they can buy up all the existing stock of housing and then just ramp up the rents. And the only way you can compete with them if you want to own a home is to pay for it outright. But it's leading these insane situations where people are selling a house and then these companies show up and they say, oh, we'll just buy the house at whatever the asking price is plus 20% or plus 10% added on top. And how do you compete with that? How do you, if you want to own a home, what do you do? And that's the whole that's the whole dilemma here, is that because the US allows for things like foreign buyers of homes and corporations to buy homes, you've got these various actors in the marketplace that can just outcompete literally everyone else. So when you ask about, are we in an oligarchy? Is this ruled by the rich? Sure is. Some of the systems are in place because they're able to lobby and spend just huge sums of money advocating for what they want that is most lucrative and profitable to them. even if that entails huge numbers of people becoming homeless, because the current mechanisms for making money through an income or through investments or whatever, however people make enough money in life to exist, just cannot compete with a hedge fund that has $5 trillion or whatever, or some firm that has billions of dollars at their disposal and they can weather any storm. How do you do it? What do you do? It's a dragon hoarding wealth, right?
Yeah.
Not everyone gets to be Bilbo Baggins.
We'll see you next week here on Mondays with Mike.
All right.